Hey everyone, and welcome back to the channel. Today we're diving into a topic that affects millions of Americans, either directly or through their loved ones, accessing healthcare as an older adult in the United States. It can feel like a complex puzzle, but my goal today is to give you a clear map to navigate it all. So whether you're planning for your future, caring for a parent, or just curious, stick around. This is information you'll want to have. Let's start with the two biggest names in senior healthcare, Medicare and Medicaid. It's easy to get them confused, but they serve different, sometimes overlapping purposes. Think of Medicare as your health insurance once you turn 65, or if you have certain disabilities. It's a federal program you've likely paid into throughout your working years via payroll taxes. It's not free, but it's a foundational piece of the puzzle. Medicare comes in different parts. Part A helps cover hospital stays. Part B is for doctor visits and outpatient care. Part D is for prescription drugs. And Part C, or Medicare Advantage, bundles these services, often with extra benefits, through private insurance companies. So, where does Medicaid fit in? Medicaid is a joint federal and state program designed to help people with limited income and resources. For seniors, it can be a true lifeline. It can cover costs that Medicare doesn't, like long-term nursing home care. Eligibility rules vary significantly by state, but if you or a loved one are struggling to afford care even with Medicare, looking into your state's Medicaid program is a crucial next step. For some folks known as dual eligibles, they can qualify for both programs, which provides comprehensive coverage. Understanding these two programs is the first most important step in unlocking affordable care. Now let's talk about a major challenge in American healthcare: the gap between rural and urban areas. It's a reality that where you live can dramatically impact the care you receive. If you're in a big city, you might have a dozen specialist hospitals within a few miles, but if you live in rural America, the nearest specialist could be hours away. This isn't just an inconvenience, it's a barrier to care. Rural areas often face a shortage of primary care doctors, specialists, and equipped medical facilities. Transportation is another huge hurdle. If you can no longer drive, getting to a routine appointment can become a major logistical challenge. This disparity leads to what's called the healthcare gap. Seniors in rural communities may delay seeking care, which allows health problems to become more severe. They also have less access to preventative services and specialized treatments for conditions like heart disease or cancer. The rise of telehealth has been a game changer for many, bringing virtual consultations to remote areas. However, it's not a perfect solution. It requires reliable internet, which is not a guarantee in all rural parts of the country, and a certain level of tech comfort that not everyone possesses. Addressing this urban-rural divide is one of the biggest challenges facing our healthcare system today. So you understand the programs and the challenges, but how do you actually get the care you need? Navigating this system can feel like trying to solve a maze blindfolded. The key is to be proactive and know where to look for help. Your first stop should be your local area agency on aging. This is a nationwide network, and you can find your local office online. They are a treasure trove of information, offering free guidance on everything from Medicare enrollment to finding local transportation services and meal delivery programs. They are literally there to help you navigate this maze. Another fantastic resource is the State Health Insurance Assistance Program, or SHIP. Every state has one. SHIPs provide free, unbiased, one-on-one counseling to help you understand your specific Medicare options. They aren't insurance brokers trying to sell you a plan. Their only job is to help you make the best choice for your personal situation. When it's time for open enrollment, a SHIP counselor can be your best friend, helping you compare plans and avoid costly mistakes. Don't be afraid to ask for help. These resources are funded specifically to assist you. Let S pull back the curtain on something that surprises many families: the hidden costs of senior healthcare. You might think that once you have Medicare, you're all set, but unfortunately, that's often not the case. Medicare has deductibles, co-payments, and monthly premiums. More importantly, the original Medicare Parts A and B does not cover everything. Some of the biggest gaps are in long-term care, dental, vision, and hearing aids. These are not minor expenses. They can add up to thousands of dollars a year. Long-term care is the big one. This refers to help with daily activities like bathing, dressing, and eating, either at home or in a facility like a nursing home. Medicare generally does not pay for this type of custodial care. This is the financial shock that can wipe out a lifetime of savings. This is where long-term care insurance can play a role, or for those with limited resources, Medicaid. The key is to understand these potential costs before you need the care so you can plan accordingly. Don't wait for a crisis to figure out your finances. So with all this information, what's the big picture? How do we truly unlock healthcare for seniors in the US? It comes down to three things: education, planning, and advocacy. First, educate yourself. Watch videos like this. Visit the official Medicare Gov website. Talk to professionals. Knowledge is power. Understand your options before you're in a crisis. Second, plan ahead. Don't wait until you're 64 and a half to start thinking about Medicare. Start researching in your 50s and 60s. Think about where you want to live in your later years and what healthcare resources are available there. Consider your financial picture and how you'll cover potential out-of-pocket costs. Planning gives you control. Finally, advocate. Advocate for yourself or your loved ones. Don't be afraid to ask doctors questions. If you don't understand a bill, call and ask for an explanation. If you're denied a service, find out how to appeal. And on a larger scale, advocate for better policies that support senior health, like expanding telehealth access or increasing funding for home and community-based care. Your voice matters. Navigating senior healthcare is a journey, but it's one you don't have to take alone. By understanding the systems, knowing the resources, and planning for the future, you can ensure that you or the seniors in your life get the quality care they deserve. Thank you so much for watching today. I know this was a lot of information, but I hope it was helpful. If you found value in this video, please give it a thumbs up and consider subscribing for more content like this, and share it with someone who might need it. Take care, and I'll see you in the next video.